How did ancient humans survive childbirth? You are only halfway into the world when the first problem appears. Your head has entered the birth canal, but the rest of your body cannot simply follow in a straight line. The passage is narrow. Its shape changes from top to bottom. Your head must turn. Then, your shoulders must turn in a slightly different direction. You cannot see where you are going. You cannot control your own body. And your mother cannot easily reach down and guide you through the most dangerous part of the journey. Somewhere outside, another human is waiting. She has no monitor, no sterile gloves, no surgical training, no knowledge of bacteria, hormones, blood pressure, or oxygen levels. She has only her eyes, her hands, and the memory of every birth she has witnessed before. She watches the mother's breathing. She listens to the rhythm of the contractions. She helps her change position. She waits for the baby's head to turn. Then, the shoulders follow, the body slips free, and a new human enters the world. That scene may have happened millions of times before hospitals, before written medicine, and possibly before anyone had a word for midwife. Human childbirth is unusual because it is not designed to be simple. The baby must pass through a tight, curved route, and the mother often cannot clearly see or safely reach the child during the most critical moment. Which raises an uncomfortable question. How did ancient humans survive childbirth when almost everything that protects mothers and babies today did not exist? No operating room, no antibiotics, no blood transfusion, no fetal monitor, no emergency vehicle waiting outside the cave, no person quietly checking a machine and saying, "Everything looks normal." The honest answer begins with something we should not romanticize. Ancient humans did not always survive childbirth. Many mothers died. Many babies died. Some women survived several births and then died during the next one. Some infants lived only because their position happened to be favorable. Others were lost to problems that a modern medical team might now solve within minutes. Ancient childbirth was not secretly safe because people were stronger, tougher, more natural, or better connected to the earth. Nature is not automatically gentle just because there is no electricity nearby. Humanity survived because most births did not produce a fatal complication, because women rarely faced labor completely alone, and because generations of humans slowly built a system of knowledge around birth. That system could not stop every emergency, but it could make ordinary births safer. It could recognize familiar patterns. It could keep the mother warm, supported, hydrated, and protected. It could receive the baby, encourage breathing, preserve body heat, support feeding, and watch both mother and child during the dangerous days that followed. Ancient humans survived childbirth, not because birth was easy. They survived because birth became cooperative. To understand why cooperation mattered so much, we first have to look at the strange route every human takes into the world. A human baby has a large head relative to the mother's birth canal. The shoulders are wide. The pelvis is not a simple round tunnel. Its opening changes orientation as the baby moves downward, which is why the head and body usually have to rotate during birth. The traditional explanation says that human childbirth became difficult because evolution was trying to solve two problems at once. Our ancestors began walking upright, which changed the shape of the pelvis. At the same time, human brains became larger, producing babies with larger heads. For decades, this was described as a simple evolutionary conflict between walking and giving birth. The real picture is more complicated. The pelvis supports the organs. It anchors muscles. It connects the spine to the legs. It helps maintain the pelvic floor. Its shape is influenced by body size, growth, nutrition, climate, movement, development, and many other forces. The baby's size is also shaped by the mother's health, metabolism, nutrition, genetics, and the length of pregnancy. Evolution was not choosing between only walking and childbirth. It was balancing an entire collection of demands. The result is a birth process that usually works, but sometimes operates with an alarmingly small margin for error. A baby in the right position may move through safely. A baby turned the wrong way may become trapped. A slightly different pelvic shape may change the entire labor. A mother who begins labor healthy and strong may become exhausted after many hours. The difference between a difficult birth and a fatal one might be a few centimeters, a change of position, the strength of a contraction, or whether an experienced person recognizes that something is going wrong. Human babies also commonly emerge facing toward the mother's back rather than looking up toward her face. That makes self-assistance difficult. In several other primates, the infant may emerge in a direction that allows the mother to reach down and guide it toward her body. Human mothers can sometimes give birth alone, but the mechanics of human birth make another pair of hands unusually valuable. This has led some researchers to propose that assisted childbirth has extremely deep roots in human evolution. We cannot excavate the first birth attendant. There is no fossilized grandmother kneeling beside a laboring woman with a label explaining what she was doing. But across human societies, birth assistance is remarkably common. That pattern, combined with the mechanics of human birth, suggests that helping during labor may have become normal very early in our history. The first birth attendants probably did not consider themselves medical specialists. In a small group, everyone knew who had seen the most births. An older woman might have given birth several times herself. She might have helped her sisters, daughters, cousins, and friends. She had seen labors that progressed quickly and others that continued through an entire night. She knew that one woman became quiet during pain, while another screamed loud enough to alert every predator in the region. She knew that shaking did not always mean the mother was dying. She knew that first births could take longer. She knew what ordinary bleeding looked like. More importantly, she remembered the moments when ordinary bleeding became something else. None of this knowledge came from a book. It came from repetition. A girl growing up in a small community might witness several births before experiencing her own. She would see where the mother sat, how attendants supported her, what materials they prepared, and which changes caused everyone in the shelter to become suddenly serious. She would hear stories. This baby arrived feet first. That mother bled for hours. This child did not breathe until someone rubbed its body. That woman survived because she remained near the fire. Another died even though everyone did everything they knew. Every birth added information to the community. Some of that information was accurate. Some was probably useless. Some was dangerously wrong. Ancient medical knowledge was not a perfect collection of natural wisdom. It was a mixture of observation, tradition, ritual, accident, fear, and desperate experimentation. But when something appeared to work repeatedly, people remembered it. That is how practical knowledge grows when nobody can write it down. One person sees. Another person copies. A third person changes the method slightly. The next generation inherits the result without knowing who first discovered it. Over time, birth assistants became a kind of living library. The experienced women were the books. Their memories were the pages. Their hands carried the instructions. And the first form of assistance may have been the simplest one. Do not leave the mother alone. Labor is not only a mechanical process involving muscles and bones, it is also an experience of pain, exhaustion, fear, and uncertainty. A woman in labor does not know exactly how long it will last. She may not know whether what she feels is normal. She may be afraid for herself, the baby, or the children who already depend on her. A trusted person can provide information. The contractions are becoming stronger. The baby is moving lower. Rest now. Drink this. Change position. You have felt this before. The baby is coming. Even when those words could not change the biology, they could change the experience. Someone could hold the mother upright. Someone could support her weight when her legs began shaking. Someone could press against her lower back. Someone could bring water. Someone could maintain the fire. Someone could keep curious children, frightened relatives, and one deeply unhelpful man from crowding into the birth space and asking whether the baby had arrived yet. Modern health guidance still recognizes the value of a chosen companion during labor. Ancient communities discovered that value without needing a formal study. When a person is frightened, exhausted, and in severe pain, being surrounded by trusted people is generally better than being abandoned. Physical position also mattered. The image many people now associate with childbirth shows a woman lying flat on her back in a bed. That is only one possible position, and it was probably not the main position used through most of human history. Women have given birth while squatting, kneeling, sitting, standing, leaning forward, lying on the side, or hanging their weight from another person or a support. These positions allow movement. The mother can respond to pain and pressure instead of remaining fixed in one place. Squatting and upright positions can use gravity. Kneeling can reduce pressure on the back. Leaning forward can make long contractions easier to tolerate. There was probably no universal ancient position. A woman might move repeatedly during the same labor. She could walk early on, kneel when contractions strengthened, squat as the baby descended, and rest on her side between efforts. The attendant's job was not always to force the mother into the correct position. It was to help her find one that appeared to work. Historical evidence shows that specialized birth supports eventually appeared in many cultures. In ancient Egypt, Women were associated with birth bricks. These bricks could support the feet while a woman squatted, leaving space beneath her for the baby and attendants. One painted birth brick discovered at Abydos is nearly 4,000 years old. It carries images connected with divine protection of mothers and infants. The object combined engineering and belief. It supported the body physically, while its images offered emotional and spiritual protection. To a modern person, those may seem like separate functions. To an ancient woman facing labor without surgery or medicine, there was no reason to separate them. If a ritual helped her remain calm, if familiar words helped her feel protected, and if those words organized the people assisting her, then the ritual was doing real work even when it could not stop a medical emergency. Ancient childbirth was filled with rituals because childbirth contained enormous uncertainty. People prayed. They used protective objects. They invoked ancestors, spirits, gods, animals, or forces associated with fertility. They followed rules about who could enter, what could be touched, and what words could be spoken. Some practices had no biological effect. Others may have accidentally improved safety. A rule requiring clean water might reduce contamination. A special birth mat might keep the mother away from dirty ground. A heated blade used to cut the cord might carry fewer living organisms than an unclean tool, even though nobody knew why. A separate birth area might reduce exposure to waste. Ancient people did not understand bacteria, but they understood visible dirt, foul smells, decay, and the frightening pattern of wounds that became hot, swollen, and painful. They could observe consequences without seeing the cause. This happened throughout ancient medicine. A treatment could work for reasons nobody understood. A harmful practice could survive because the damage appeared later and was blamed on something else. A harmless ritual could gain importance because a mother survived after it was performed. Birth attendants also used plants. Some were given as drinks. Others were crushed into oils, burned as smoke, placed in compresses, or applied to the skin. Plants might be used to reduce pain, calm the mother, encourage contractions, control bleeding, or support recovery. Some plants contain compounds that genuinely affect pain, muscles, blood vessels, or the nervous system. That does not mean ancient herbal medicine was automatically safe. The difference between a useful amount and a poisonous amount can be small. Plant strength varies. Preparation matters. One person may react differently from another. An herb that appeared to speed labor could also make contractions dangerously strong. A substance used to reduce pain could weaken breathing. A preparation placed on a wound might reduce bacterial growth, do nothing, or create an infection. Ancient healing was observation without controlled testing. Sometimes the result was impressive. Sometimes the patient became the test. And when childbirth produced a serious complication, the limits of ancient knowledge became painfully obvious. Consider obstructed labor. The baby may be too large for the available space. The head may be positioned badly. The shoulders may become trapped. The baby may be lying sideways or presenting feet first. An attendant could encourage the mother to move. She could help her squat, kneel, turn, or rest. An especially experienced person might recognize an unusual presentation and attempt to assist. But there was no reliably safe surgical solution. A cesarean birth before modern anesthesia, infection control, surgical technique, and blood replacement carried enormous danger, especially for the mother. Ancient attendants might understand exactly what was going wrong and still have no way to stop it. That may be one of the most terrible forms of knowledge, recognizing the danger without possessing the tool that could solve it. Severe bleeding was another threat. After the baby and placenta are delivered, the uterus normally contracts and compresses the blood vessels that supplied the placenta. If the uterus does not contract effectively, bleeding can become life-threatening very quickly. The attendants could see the blood. They could keep the mother lying down, apply pressure, massage the abdomen, offer fluids, maintain warmth, and use traditional remedies. But they could not replace the blood she had lost. There was no transfusion. No emergency medication with a carefully measured dose. No surgeon prepared to repair internal injury. A woman could complete the entire labor, hear her baby cry, and then die while everyone around her understood that she was disappearing but could not bring her back. Infection often came later. The mother might appear stable after birth. Then over the following days, she could develop fever, worsening pain, weakness, confusion, or a foul-smelling discharge. The community might use washing, plant preparations, smoke, prayer, food, warmth, or rest. Sometimes she recovered. Sometimes the infection spread. Without antibiotics, the body had to defeat it largely on its own. High blood pressure disorders presented an even more confusing danger. A pregnant woman could develop headaches, swelling, changes in vision, pain, or seizures. Ancient attendants had no device to measure blood pressure and no clear understanding of the process. To them, a seizure during pregnancy might appear supernatural. Rituals could organize the response and provide comfort, but they could not reliably treat the underlying condition. This is the part of the story that must remain honest. Ancient humans survived childbirth as a species. That does not mean ancient childbirth was safe for every mother. The chain leading to us is unbroken only because the people who survived became our ancestors. The ones who died did not leave descendants to tell the story. Survival creates a distorted view of the past. We see ourselves and think the system must have worked well. It worked often enough. That is not the same thing. When the baby was born safely, another race began immediately. Newborn humans are helpless. They cannot walk away from danger. They cannot find food. They cannot control their body temperature efficiently. They enter the world wet, exhausted, and entirely dependent on adults. Warmth mattered from the first moments. The baby could be dried with available material and placed against the mother's body. Skin-to-skin contact turns the mother into a living heat source. Fur, cloth, soft plant fibers, or another dry covering could be placed over them. The baby did not need an incubator when the mother's chest was warm, and both were protected from wind. That does not mean every ancient newborn remained warm enough. Premature and very small babies would have been especially vulnerable. But direct body contact was one of the most effective tools ancient humans possessed. Then came breathing. Most babies begin breathing without complex intervention. Attendants could rub the body, clear visible material from the mouth or nose, keep the baby warm, and watch for movement. If the baby still did not breathe, ancient people had few reliable options. They probably tried everything they had seen or imagined. Rubbing, blowing, moving the child, calling its name, praying, pleading. Some babies responded because stimulation and warmth were enough. Others could not be saved. The cord had to be managed as well. Different communities tied it, cut it, or waited before separating the baby. Tools might be made from stone, shell, bone, bamboo, metal, or other sharp material depending on the place and period. The safety of that process depended heavily on cleanliness, though nobody could see the microorganisms involved. After warmth and breathing came food. Human milk was the newborn survival system. It provided water, energy, nutrients, and immune protection. It required no storage container, no cooking fire, and no prehistoric instruction label that someone had already lost. It also kept the baby close to the mother's warmth and protection. Breastfeeding, however, does not always begin easily. A baby may be weak or premature. The mother may be exhausted, injured, ill, or struggling to produce enough milk. Again, survival expanded beyond one person. An experienced woman could help position the baby. Another lactating mother might feed an infant whose mother had died or could not nurse. Wet nursing is not a modern invention. It is part of a much older reality in which human children were often supported by more than their biological parents. The baby belonged to the mother. The work of keeping that baby alive could belong to the entire group. The same was true for the mother's recovery. Birth did not end when the baby appeared. The mother needed food, water, warmth, rest, protection, and time for her body to heal. Someone else had to gather fuel. Someone else had to prepare food. Someone else had to carry water, watch older children, repair shelter, and respond if the mother became weak or feverish. A woman forced to resume heavy labor immediately would face additional danger. A woman protected by relatives had a better chance to recover. Postpartum care was therefore not just kindness. It was survival technology. This may also help explain the importance of older women in human communities. A grandmother could contribute knowledge, food, childcare, and practical support even after she was no longer giving birth herself. She had watched more children become sick. She knew what normal newborn breathing sounded like. She knew which mothers had recovered quickly and which signs had appeared before a death. In a world without records, her memory was the record. In a world without professional schools, experience was the qualification. Ancient childbirth was not an isolated event involving only a mother and a baby. It was a community operation. People prepared a space. They gathered water. They maintained fire. They provided bedding. They supported movement. They watched the labor. They received the child. They preserved warmth. They helped with feeding. They protected recovery. Then they remembered what happened and carried that knowledge into the next birth. Over thousands of generations, this repeated process created a culture of assistance. The culture did not eliminate biological danger. It placed more eyes, more hands, more memory, and more resources around it. Modern medicine added the tools that ancient birth attendants lacked. Blood can now be replaced. Infection can often be treated. Blood pressure can be measured. A trapped baby may be delivered surgically. A newborn who does not breathe can receive structured resuscitation. None of these advances prove that ancient people were ignorant. They prove that knowledge becomes far more powerful when it gains the right tools. So do not imagine the ancient mother walking alone into a forest, giving birth beside a river, and returning to camp an hour later as though she had briefly gone out to collect berries. And do not imagine a circle of helpless people randomly waving leaves while waiting for nature to solve everything. The reality was more difficult and more impressive. There was expertise. There was fear. There was experimentation. There were methods that helped. There were beliefs that comforted. There were mistakes that caused harm. There were emergencies no ancient person could solve. And there were countless ordinary births made more survivable because one human remained beside another. Return now to the moment where we began. The baby's head has entered the world. The shoulders are still inside. The mother cannot see what is happening. But she is not alone. Someone is watching. Someone recognizes the turn. Someone supports the child as the shoulders follow. Someone catches the small, wet body before it reaches the ground. The baby cries. The mother breathes. The people around them move closer. They bring warmth. They bring food. They bring memory. That is how ancient humans survived childbirth. Not because ancient women were invincible. Not because nature was merciful. Not because every birth went well. They survived because one of the most dangerous moments in human life became one of the most cooperative. The machines came later. The hospitals came later. The written textbooks came later. But the first essential practice was already there. One human stayed beside another. One generation helped deliver the next. And every person alive today is evidence that, often enough, it worked.